Hey, my name is Charles Net, and I'm doing my program evaluation on a nurse-led CAUTI protocol for a neurology unit inside the VA. 30 to 40% of all healthcare-acquired infections are actually CAUTI, and they cost the healthcare industry $45 billion in preventable injury every year. And it's actually nationally on the rise right now, but nurses can help reduce the cost of that because one of the most essential things is a bladder bundle, which is to decrease unnecessary use of indwelling urinary catheters, using aseptic technique when you insert them, determining the necessity every day, and to remove as soon as possible, because neurology patients are going to need indwelling urinary catheters. So the biggest thing is to try to decrease the length of time they have it and try to be as safe as possible about inserting and removing it, and try to decrease the length of their hospital stay. Many nurses know that the protocol exists to have catheters removed and to try to minimize use, and about the use of sterile technique with the insertions, but the new nurses coming onto the neurology unit actually receive no education on the existing protocol and tools. So to try to design and implement a bedside nurse e-learning module that's going to help people learn about the existing things inside the VA for the tools we have. One of the essential things of this program is going to actually be to try to figure out what barriers the nurses have to the bladder bundle or the existing CAUTI protocols. Is it a lack of knowledge? Is it a lack of knowledge about the importance of preventing the UTIs? Is it time management? Do they have too many patients? Or is it because the VA allows unlicensed staff to perform tasks, which is really unique to the VA that CNAs are allowed to insert indwelling catheters? And then so it's going to be qualitative nurse and nurse's aide interviews to design and implement the learning module, and then to try to decrease the rate of CAUTI and the decrease of the use of catheters, and increase the knowledge about sterile technique, especially for the nurse's aides. So the other part of it is to perform a quantitative chart audit pre and post intervention on a random sample of patients to see if the protocol was implemented for them. The e-learning module will be designed to address the barriers that are identified in the nurse and nurse's aide interviews, and to overall just try to increase education and awareness about the existing CAUTI protocol for the bladder bundle. And the biggest thing is making sure to use the information from the qualitative nurse and nurse's aide interviews in regards to creating the module for the bladder bundle, and then to perform the quantitative chart audits to see if it was actually implemented. And then overall, we want to increase patient safety and have better outcomes, and we want people going home without infections. Here are my references. Thanks for listening to me, everybody.